Welcome back to the Theramax training. This is the part wherein we fill out the physical assessment. Okay, so this is again, we're using the cancer form for this, but in the future, if ever we have a new software, they may have a different setup. But remember, guys, even whatever software we're using, the requirement for documentation is still the same. So it still follow the principles of what we're discussing here. So orientation here, the first one is the orientation. The, the one here from orientation up to the posture, we will be asking you only to do the drop down. If ever you miss one here, we will be asking you to will be returning your note. Now for the boxes for the functional impact, if ever you don't fill this out, then we will not be returning your note. We're only gonna be very particular with the drop down. But for the sake of a good documentation and for a better picture of what's going on with your patient's case, then I will recommend you to write it down. But since you're a therapist and the back office is only a support team to make sure that whatever we're sending to the insurance, to the agency is correct, their role is to make sure you fill it out. But as a licensed person, it's your role to make sure that whatever is you're writing there, when you submit the note, then you're giving a good picture of what's going on with the patient, and that picture, this will help if you feel this functional impact. The next one is the edema. If you click absent, then right away you don't need to write anything, you can go straight to the pain assessment. But if you put present, we will return to you the note if you don't fill out one of this in the location. We will not return to you the note if you missed this one and you missed one. We will not return it to you unless, of course, the home health agency or the client returned the note and said, you need to fill us out. So for the job order, but they will specify it beforehand. So to reiterate again, if you click present, we will return the note only if you miss the dependent or repeating choices in the location. The next one is there is a psychiatric worksheet here. We actually don't use this. Probably in the future, if there is a special request, a special job request from the client, we will do, but we never use this ever since. The next one is a pain assessment. This is very important. Pain assessment, either you check no, then right away, if you can see, it blocked all the boxes here. But if you don't check no, we assume that the patient has pain. So if you didn't check this and you didn't fill this out, we will return it to you because you may just forget that you didn't put if there's pain or not. Now, if there is pain, then you need to put what part, or you can put other if you need to put another part here. The intensity is very important. If the intensity is only 5 and below, you don't need to report to the home health, to the doctor's office or to the home health agency. But anything 6 and above, then you need to report. You need to write a documentation. You need to call the home health agency, or depending with the regulation, most of the company wanted you to call directly the doctor's office. So you call the doctor's office. You can see the patient's chart and the number of the doctor. Patient's chart on our electronic medical record or on the patient's book in their house. Call the doctor. If the doctor doesn't respond, leave a message, and then call the home health agency and notify them about the pain level and write documentation under the coordination of care below this documentation. When you are calling the doctor or the home health agency, they will ask you two things. Is the patient symptomatic or asymptomatic? So you need to ask the patient right away before you call to save time. Second, if the patient has pain, ask the patient if he or she has pain medicine. If yes, when is the last time that she took it? Because those are the two things that the home health agency will be asking you. Now, if the pain level is high, when you ask and the pain level is high, you can ask right away, did you take your pain medicine? If not, ask the patient to take the pain medicine right away while you're doing the evaluation, and then before you leave, ask again if what's the pain level. In that way, you don't need to call the home health agency if the pain level goes down to 5 already. Okay? So anyway, so this needs to fill out. Now, if the patient has pain, especially for the pediatric or for the confused patient, and they cannot uh, specify the intensity, then you can fill this one blank. But in one condition, if you want to fill this one blank, and if you don't want the Teramax back office to return the note to you, you need to put a note here. Patient unable to gauge the intensity level. You can even say, but patient is in gray maze or whatever. You can put a subjective there, but you need to put a note here. Okay. And then you need to fill this 3. If ever you can the patient cannot say anything to you, you can just put NA NA NA, but it needs to be filled out, because if this is blank, there's no NA, and there's pain, they will return it to you. Okay, so this is where you're gonna write your documentation. Where is that? Conference with care coordination. You can put it here, or you can put it here. That is also where, remember, you put your if there's an abnormal vital sign. Okay. So we're done with the pain. The wound care worksheet, we don't really do that. Ever since I work in home health for 10 years, no one asked me to do that. So in case they're gonna ask you to do that, then they will specify that before they send the order. The range of motion and strength, there's also things here that I want to discuss. If the patient is having an OT and PT, PT may not don't need to fill out the upper extremity, the from shoulder to wrist. All you need to put is OT, Eval. Do the same thing here. OT, Eval. You have a choice to just delete all of this, or just put OT, Eval, all of these boxes. So let me put it back first too. So, but that's what it is. You don't need to put to fill it out if there's an occupational therapist seeing the patient, because there is it's a double documentation already. What if you see the patient 30 minutes ago, and then the OT saw the patient after that? Then your answer here 2 plus over 5, and then the OT answered, if you're a PT, you answered 2 plus over 5, and then 30 minutes ago, or 30 minutes after, the OT answered 4 over 5. So there's inconsistency of the information. It's better for us to leave the upper extremity to the OT and ask for the trunk, for the PT for the trunk and the lower extremity. Another one is, be careful if the patient has an amputation. For example, there's an amputation on the left knee. Make sure that there is no documentation. You need to put NA here instead of putting this answer or putting a muscle strength. Okay. Now there is a description of functional impact here. You may or may not fill this out. If ever you don't fill this out, Teramax will not return it. But if you miss to fill this range of motion and strength, Teramax will return it to you. You can answer here within functional limit, within normal limit, NA tight, whatever you want to answer, NA, NT, as long as it's answered. Remember, Teramax only, check your note, but you as a licensed person is the one who decide what to put there. So we will not return if you miss this box here. So this ends the training for the physical assessment. Thank you so much.